My name is Everett Jeffries.
And I'm Dylan Hillman, and today on the Informanauts, we'll be looking at fibrodysplasia ossificans progressiva.
This super rare disease is also known as SMS, Stone Man Syndrome.
Today we are here with the famed Dr. Cornelius and Dr. Harlington, two of the leading world FOP experts.
So doctors, could we please get a general description of this gruesome disease?
Yeah. Now the technical term for Stone Man disease is fibrodysplasia ossificans progressiva, as Dylan has stated here. And Everett, you have some words about this?
This is a genetic disease that affects 1 in every 2 million people, so it's quite rare. FOP, as it is generally called, is a cellular level disease that turns muscle and connective tissues in your body to bone.
Targets soft tissue area, slowly turning it to bone. And so that this can be increased by muscle trauma, extra stimulation. So like muscle trauma could be falling, or see if I punch Dr. Cornelius here, like that. See, that would speed up the process. And so it'll ossify faster than the normal rate. And so here, it would speed up this area only.
The legs would start to turn to bone, but not this leg, just this leg, just the area that's affected. For their life, those affected by FOP start growing bone all around their body. Ribbon-like masses of bone weave themselves between and around the ribs and lungs, restricting breathing. Spears of bone have been known to protrude from the thighs and the back.
Interrupt. But couldn't the bone be surgically removed?
I'm glad you asked that. In the past, doctors have tried surgical operation, but the result has always been the same. The patient's body just replaces the bone mass and continues at an increased speed, so it's a negative effect of surgical operation. Scientifically, FOP is caused by a malfunction on chromosome 2q23-24. Either the chromosome is damaged or is mutated in some way, making the cells want to turn into
description, doctors. Thank you for that. Now, could you give me a brief history of this terrible, excruciating disease? The first documented case of FOP was in France in about 1692. The French physician actually saw large back swellings, seemingly bone. There have been a few other documented cases, but this seemed to be about the first. Oh, I see. Oh.
There are approximately 700 cases known to researchers worldwide. Before 1970, FOP completely mystified doctors and scientists all over the globe.
The famous FOP victim was a man named Harry Eastlack. He was born in 1933, and his FOP started coming in at age 10. And he died in 1973 because all he could move was his lips. His whole body was solidified, and he gave a skeleton to a research foundation. So, but the research didn't really help all that much.
He was the most well-known FOP patient. This disease, how will our viewers know if they have it?
Yeah.
Like, what are some of the symptoms? It starts to take effect in the adolescence and puberty stages. This is usually when abnormal bone growths start to appear. However, FOP is different in every patient, and the symptoms can vary for every person.
Deformed toes are not always an absolutely sure sign of Stone Man syndrome. Blood tests can be used to prove it's a definite diagnosis, of course. This disease is on a cellular level as it turns muscle and connective tissues. Now, is there any cures or treatments for FOP?
Well, currently there's no known cure for the Stone Man syndrome. All drugs used in the past have either had no effect or increased the speed of bone development.
Some patients have actually realized that they found their own special ways to deal with this, their own special treatments, you see. And see, one man, he actually kind of did a reverse psychology trick almost on it. He started taking large amounts of calcium, prescribed biophosphorates and cardiosteroids to fight the pain, but did nothing to combat the bone.
All they do is to help fight the pain. Because as you see,
the nervous system is just crazily affected. It just hurt lots of pain just because you can't.
As can be expected. Like if your hand turning into bone, it's probably going to be painful. If you
Imagine having a knife going out into your skin.
That's exactly how it feels.
That's basically...
Scientists may be developing a specific gene therapy medication to fix the mutated genes, but there is no cures on the market at this present time. Is daily life affected by FOP?
Well, younger patients, they can pretty much live a very normal life, except that they have to be very, very careful when doing any activity, any physical activities, like sports or anything like that. But other than that, fairly normal.
Falling is the #1 accelerator of FOP. Patients must also avoid needles because they provide muscle trauma, which can increase the ossification process. As Doleman syndrome's victims age, they become increasingly immobile.
The life expectancy for FOP victims is sadly very, very young. 40 years of age is normal for that, and there are 5 main body systems affected. The respiratory, mainly because you're trapped inside of your body and your lungs can't get enough air.
It's slowly pressing down on it, making it harder to breathe. The muscle system gradually decreases, and the skeletal system gradually grows. When you have FOP, you most likely become sterile. This means that your reproductive system has been knocked out.
The last system affected is the nervous systems. As we said before, patients register a lot of pain when the muscle is ossifying. This is truly a terrible feeling. Thanks to our esteemed doctors. Good luck with your research of FOP.
If you would like to help support those with FOP, or if you would like to help fund research for a cure, you can donate at www.ifopa.org. This is a secure website, and your donation really helps.
Thanks for watching. If you have any questions, we would gladly answer them. And this has been the Informanauts. Over and out.
Oh, did you look at that? And anyways, ready? Is daily life affected by FOP?
Technical difficulties. Phone on the set.
Descriptive thing that you did there.
Make it rain.
Get off the phone.
Hold on.
Famous case of FOP was in. Oh, but of course. What is it? I don't know where we are, so I'll just keep talking. Bone cells. Stop. And for tonight, that is all.
Thank you.
Good night.